Whisper. I'm a physical therapist that specializes in pelvic, visceral, and orthopedic physical therapy. So it might be a little hard to hear me because I'm outside walking and it's a little bit windy where I am. But I have been getting so many questions regarding sway back posture or lumbar lordosis, excessive lumbar lordosis. There's different terms or names for it. So I kind of wanted to go on and answer some of the common questions or the repetitive questions that I've been getting because they're really good. So the first thing to know about sway back posture or lumbar lordosis is that there is a genetic component, meaning that everybody's posture is going to be a little bit different depending on their genes. Some of us are going to have more sway because that's just how our parents are, our siblings. But the point of bringing it to attention is not to say, make fun of people that belly stick out because I have had that posture and I've also been told that many times, especially growing up as a kid. And it can make you very self conscious. It can make you feel, um, you know, really insecure. So when you're addressing these, especially to kids, you need to be very careful because I've gotten referrals even from doctors or parents that come in really concerned saying, look at my kid, look at the way their belly sticks out. And the way they're describing it is they're actually concerned, but it can actually make their kid feel even more insecure. So the point is that if your kid has that and you have that, that's okay. That's just your genetic predisposition. But the point is, maybe your job is making that worse, meaning maybe you have a desk job where you're sitting for long periods of time. And when you're sitting, then your hip flexors are going to be in a shortened position. And now they become stiff. So, what can happen over time is, let's say you have a desk job and you sit 8 hours a day. Well, when you're young, right, in 20s, 30s, 40s, you're not maybe going to even notice that. But as you start going on years and years, you're going to have a harder time getting out of that posture because now your hip flexors aren't just tight, they're shortened. So they're stiff to the point where they're going to need long duration stretching, maybe even manual therapy, treatment with like cupping, instrument assisted tools, manual therapy. So the point of this is to let people know that if you have this, that's okay. Here's how you can prevent it from getting worse, or even prevent it if you have a kid or someone that's young enough to manage those symptoms. So um, hello. Okay. Mama for former runner, transferred to a desk job 3 years later, do not recognize my body. Yeah. And if you were already a runner, so I'm a runner too. That's a great point. You're going to have tight hip flexors because you're using those muscles a lot during different phases of gait. So um, you're already going to have tight hip flexors. And for a lot of us, even I've noticed this now as a mom with my 7-month-old, I only have time for, maybe sometimes a 30-minute workout or 20 minutes or even 5. So if I go for a run, I go run and then I don't have time to stretch and do all these other things that I did before. So now I'm even more stiff. And then I go sit and I pump and I breastfeed. And it's like my hip flexors on top of having a C-section. So if you follow me, you know that I had an emergency C-section. And what a lot of people don't realize is that when you have a C-section, it affects your pelvic floor. It affects everything in that region. So for a lot of people, they have issues. So it not only did it make my pelvic floor even more tight after a C-section, but then my hip flexors, the front of my hips became even more stiff because of scar tissue healing. So, if you're somebody that has, multiple surgeries in your abdominal pelvic region, like a hysterectomy, um, hernia repairs, and again, this is not just for females. Inguinal hernias are extremely common in males, so important to bring that up too. This is not something that just happens in females or during pregnancy. Sway back or lumbar lordosis can just happen, and that's why so many people spend so much time, trying to strengthen their core because people say, "Oh, your belly's sticking out," and people make very inappropriate comments about, how many months are you, when they really shouldn't be commenting about your body at all, sadly. Um, so how can you change your hollow back? I have a belly because my back isn't straight. Yeah. So if you have that sway back, and the biggest thing you're going to want to do is figure out, okay, if I have that sway back, is it because I'm really stiff in certain muscles, right? You're going to have muscle imbalances. What muscles are stiff? You need to stretch the tight muscles. Okay, what muscles are weak? So, for instance, that lower cross syndrome that I was mentioning, typically you have tight hip flexors, tight erector spinae or back muscles, and then you also have weakened abdominals and weakened glutes. So, what you want to do is stretch the erector spinae, stretch the hip flexors, and then also strengthen your core and your glutes. But I talk about this a lot in my method. The reason that I talk about my method so much is because as a doctor of physical therapy, I don't just use it for patients that have abdominal pelvic issues. I use it for all my patients. So if you're coming in to see me for like a rotator cuff repair or a total knee replacement, Achilles repair, whatever it is, I'm not just looking at that one site. I'm looking at your whole body, your posture. So when we talk about the healing process, there's really a hierarchy of how you treat it. So, for instance, if you don't know how to do breathing, diaphragmatic breathing, then I start there, regardless of what you're coming in for. But usually, people that don't do diaphragmatic breathing well, they've got lung issues, COPD, um, pulmonary stuff going on. They have back pain, hernias, diastasis. Or they've had old surgeries that they've never gotten scar treatment for. So typically, you can kind of look at somebody and how they move, how they breathe, and you can actually kind of figure out, okay, just by watching how you got out of that chair, how you stand, how you move, I can already tell what things are probably tight and weak. And then as a physical therapist, we assess that during our evaluation. So your PT should be looking at your entire body, not just one part, right? Like I talk about all the time, pelvic floor stuff, always common with jaw TMJ issues. So that's why there's that connection. So again, just a little note in case you have kind of different injuries, multiple body parts, and you're kind of trying to link those together. Sorry, I'm missing all these questions because I want to talk. Hey, Jonathan. Sorry, a friend just popped on. I have UC, gluten intolerance, endometriosis, and away from back years of gymnastics. Oh, yeah. So you have a lot going on. And even another great point bringing up gymnastics, the female triad or kind of um, going on with like decreased intake of calories, right, having irregular menstrual cycles, a lot of female athletes have a lot of pelvic back pain, chronic pain, things going on because they are training so hard. So again, kind of talking about that earlier, really important if you have a kid and they're having issues like this, make sure you get them checked out. And unfortunately, you had endo, they probably missed that. You probably had extremely painful periods that you had to fight through during training. So I can't imagine. Um, so again, going back to how do you fix the sway back, starting with diaphragmatic breathing and then moving on to, correcting your posture. What is your posture? Maybe you don't have sway back. Maybe you're thoracic, you have kyphosis and you're rounded in your upper back and you have a forward head, right? So it depends on what you have going on, but you got to fix your posture next. And then the next part of my program is stretching. So again, if you check out the belly whisperer method, I have lots of information on hip flexor stretching, back stretches, pelvic floor stretches. And then next, once you got that length, then you need that stability or that strength. So then you're on to strengthening. So if you're really interested, I would check it out. Honestly, in my method, I spent so much time making it. It's what I use to treat my patients in the clinic, and it has so much information that you're going to be honestly saving so much time from going to see a therapist for multiple sessions when you can get information all at once, especially for issues like that. And again, sway back, right, might not be a thing now, but maybe later on you have a disc herniation or an anterior listhesis or a retrolisthesis, or you start to develop stenosis or other issues going on. So, and then somebody mentioned I have a disability, so that doesn't help too. Yeah, that's a really good point. You bring that up. So some people, if you have certain um, neuro or congenital diseases or issues going on, it will also determine different things, right? Like let's say you have spina bifida, cerebral palsy, Ehlers-Danlos syndrome. I mean, there's so many different types of diagnoses. A spinal cord injury. Those things are going to not only affect your posture, but also other things, maybe your pelvic floor, bowel, and bladder issues. Um, so yep, I didn't get endodiagnosis until after my fourth birth. Yeah, so want to regain core and pelvic floor strength. Oh, you should check out my method. The Bellwether method, definitely recommend. Yeah, I have CP. Yep. So I actually know quite a few people with CP. So there's a lot of other things that can be involved with that. Oh, charcuterie foot. Yep. You're gonna lose your leg. I'm so sorry to hear that. You know what? That's another thing that you bring up is really good because I actually did home health for a couple of years. And unfortunately, when you're doing home health, you're seeing some of the gnarliest, sickest people. And it's not just people you would think in their 80s, 90s, it's young people, it's everybody. So, my heart really goes out. I hope your surgery goes well. Make sure you get good therapy after, good wound care. good fitting for your boot and everything. Um, are you a physiotherapist? Yeah, I'm a doctor of physical therapy. Okay. I've been watching your tips. How do I access the full method? Oh, there's a link in my bio that should take you to the full method. I have a one-time payment plan, or basically I have the content dripped slowly in a monthly program, depending on what you want to pay for. But you just missed the sale, so feel free to DM me. I can extend that to you. So if you're so interested in getting it. Um, okay, so I have to go soon, but I think I brought up the big points of sway back because I just want to get that out there that, it's something that, again, there is a genetic component, but again, those repetitive postures, those things that you do every day, your type of exercise, how you live your life is going to determine whether you have more of that, less of that, how you correct it, right? Because sometimes you may be trying to strengthen your core, but if you can't posture your pelvic tilt or you can't get into the right position, it's not even going to help you, and it can even make your pain worse. It can cause back pain while you're exercising, and you never want to feel anything in your back, especially if you're trying to work your core. Okay, I gotta go. I'll post this if I can download it on my Facebook page as well as my Instagram page and maybe my YouTube. So that way, if you're just hopping on, you can rewatch it. So I gave a lot of good nuggets, even though I'm breathing heavy and I'm walking around. But baby girl's sleeping, so I gotta do what I gotta do. All right, everybody, have a great rest of your Sunday.